Hi, I'm Dr. Michael DeTola.
And I'm Megan Strong.
Get your hot pocket out of the autoclave. It's time for Chairside Live. Welcome to episode 12 of Chairside Live. Megan, how are you today?
Doing well, how are you?
Feeling tremendous, thank you. Instead of a case of the week this week, we're actually going to do a little product spotlight where we take a closer look at probably our most popular product right now, and that's BruxZir. In fact, Megan, I was just on the phone this morning with Dr. Gordon Christensen, talking to him, letting him know how many BruxZir crowns we did last month. And he actually commented that he thinks that this switch to BruxZir crowns and to monolithic crowns is kind of the fastest paradigm change that he's ever seen in dentistry, rivaled only by when dentists used to use those belt-driven handpieces, and then they switched to the air-driven handpieces back in the early 60s. So we're going to take a little closer look at that product because I want to show you something we had a chance to do yesterday, kind of a variation of the hammer test that you may have seen us do before. But before we get to that, let's go to Megan and the news.
It looks like the folks over at ABC's popular morning talk show, The View, are biting their tongues after recent comments regarding dental hygienists. In a segment titled "Where Are the Jobs?", a financial expert incorrectly said that you don't need a college degree to become a dental hygienist, and the average salary of a hygienist is $45,000. Faced with major uproar and backlash from dental hygienists around the country, the American Dental Hygienists Association complained to the network. They requested that an accurate portrayal of dental hygienists and the role they play be presented to the public. The View responded by issuing a statement correcting the false information they broadcasted and set the record straight by saying that hygienists have to complete a rigorous certification program and may obtain at least an associate's degree in the process. Some even go on to a bachelor's or master's degree. They also stated that the median salary for a dental hygienist in 2010 was around $68,000, not the $45,000 they previously reported.
Well, as you know, I TiVo The View on a daily basis because I like nothing better than 7 women all talking at the same time. That's how I prefer to get my information. And it's interesting, though, that the hygienists, when the number was reported and it was too low, they came back and corrected them to say it was too high. To me, that's a sign of a profession that has a lot of self-esteem because they're willing to do that. You can imagine if they went on the show and reported that dentists, say, only made $100,000, the ADA probably wouldn't run back and say, no, we make $240,000. What are you saying? Because the public might not react to that well. But considering that we've had a shortage of hygienists in this country for the last 2 decades, I'm happy to hear that whoever saw this program might be inspired by this and might want to go to hygiene school because we still and always will need more hygienists.
Sure.
Anything else, Megan?
Yes. If you have a hard time getting your kids to brush their teeth, you might want to show them the latest video from the Oregon Dental Association. Take a look now.
Ain't no black retarded living in my mouth tonight. You gotta brush it right until the morning light. Okay, pull out the string and it's time to get your flossy on. Get at the food, make your gums grow up nice and strong. I floss in public and people sometimes stare at me, but you just do you. And I'ma floss like me. I brush and floss every night, baby, if you please. So I grow up healthy, no sign of gum disease.
Teach me how to brushy, teach me how to brushy, teach me how to brushy, teach me how to brushy.
All my teeth.
Sung to the tune of the group Cali Swag District's hit song Teach Me How to Dougie, the song Teach Me How to Brushy has fun and catchy lyrics promoting good oral hygiene. Featuring cute little kids dancing around brushing their teeth and flossing, it's a fun tool parents can use to take some of the headache out of teaching their kids about healthy dental habits. The association also created a Facebook page with quick facts and frequently asked questions. They are inviting parents and kids to create their own video to submit to the association.
Wow, I have never felt so old and so white as I do right now. I didn't even realize that Cali Swag, or whoever you mentioned, had a song called Teach Me How to Dougie. Were you aware of this before?
Yes, of course. Have you been living under a rock?
I have been living under an old white rock now that you mention it. And so this is the dance that people have been learning?
It is a dance,
okay.
Yes, and a song, but the dance is the most popular part. Okay,
well, I guess I'm old enough now. I was aware of the Macarena and the chicken dance, and even the Cabbage Patch for a little street cred. But I wasn't aware of this, but you know what? We've tried everything else, to get people to brush and floss and try to get the interest of kids. And I don't think anybody's ever taken an approach quite like this. So I don't know that gangsta rap is going to fall by the wayside in favor of this, but I think if you're trying to get your kids interested in good oral hygiene habits, this might be a nice way to start. Thank you, Oregon Dental Association. All right, now let's go ahead and take a look at the case of the week. As I mentioned earlier, I wanted to take a closer look at one of our more successful and popular products right now, and that is BruxZir, the full contour zirconia crowns. And they have really taken off. In fact, about a year and a half ago, the amount of BruxZir crowns that we did actually surpassed the number of Emax crowns that we did. And I found this to be quite surprising because I was very happy with Emax at the time. It looked good. It was strong, 3 times as strong as Empress. And yet along came BruxZir, which was 3 times as strong as Emax, but it didn't look nearly as good. But regardless, it just flew right past it, and it taught me something that I didn't realize, and that is that most of the doctors in America care more about strength, about ultimate strength, than they do about ultimate aesthetics. And so this restoration, BruxZir, just took off right past Emax and hasn't looked back. Both of them continue to grow at a very, very respectable rate, about 25% per month. And so both of these materials, the monolithic revolution as we call it, continue to reshape dentistry. So you may have seen the hammer video that we've had online for some time. In fact, let's go ahead and take a look at it now. And in the original hammer video, what we did was we wanted to kind of illustrate how strong BruxZir was going to be when compared to a traditional PFM. And so what we did was we just took a regular 2x4 and we've set the PFM onto it right here. And now I'm going to hit this about half my strength because I'm a pretty strong guy. And you can see it just pulverized the porcelain right off the PFM. Of course, the metal coping's not damaged because that's the strong part of the PFM. The weak part of the PFM is the glass that's fused to that metal coping. So here's a BruxZir crown. Now there's no porcelain on a BruxZir crown. It's just a solid piece of zirconia oxide. And when we hit that with the hammer, you can see that nothing has happened to the crown. In fact, the BruxZir crown probably doesn't even know you just hit it with a hammer. It may have been napping and you might have woken it up, but that's about it. It's just looking around saying what happened, what was that loud noise. The PFM has been destroyed and the BruxZir crown is still intact. So a big part of the story with Emax and BruxZir is that neither of these have any external porcelain added to the outside of it. You can see the wood just fills up that BruxZir crown, and the margins are in fact still intact. So when people talk about aesthetics, I really think aesthetics go back to the 1960s when the PFM crown was originally invented. Before that, we had cast gold crowns, probably the best material we've ever had in dentistry, but at some point dentists wanted something more aesthetic, something that at least looked like a tooth, and so the PFM was born with the metal substructure and then porcelain fused to the outside of it. The problem is, anytime you put 2 dissimilar materials together and then heat them up in an oven and it cools down, there's a chance those 2 dissimilar materials will come apart. So now you've got a monolithic material. You've got BruxZir, which is solid zirconia, or you've got Emax, which is solid lithium disilicate, and neither of these have porcelain on the outside, so it's a monolithic material and therefore much stronger, much more chip-proof. So the other day, we've been playing around with anterior BruxZir now for about a year because dentists started prescribing it for the anterior. And one day somebody said, can you guys make some BruxZir veneers for me? And we hadn't even started thinking that far. So we've been playing around with BruxZir veneers, and now we're actually giving them to dentists who prescribe them. So I took a BruxZir veneer the other day, and this is another hammer test. Let's go ahead and take a look at that. So what I'm going to do here is take a BruxZir veneer. You can see that it's a typical veneer thickness, about 0.6 of a millimeter. It can be milled a little thinner than that even if you want. And we're going to stand it up, and gingival margin first. We're going to set it onto the wood and start to tap it into place with a hammer. You know, remember on the first one that we did, it was an actual crown that we just hit really hard with a hammer and drove it into the wood. But we started thinking, what if we were able to demonstrate how strong these veneers would be? And you can see that BruxZir veneer is literally just being hammered right into the wood itself until the incisal edge is actually flush with the rest of the wood. So we'll go ahead and dig this out in a second so you can see that the BruxZir veneer is still intact. Now, again, the point of this is just to show the strength of the material, the strength of the zirconium oxide, and I'm not suggesting that you abandon Emax veneers, for example, and go over to BruxZir veneers right off the bat. I wouldn't do that unless I saw a patient who had broken previous restorations in their mouth, or somebody who showed a ton of anterior wear before, and you know they're going to put a lot of stress on those restorations. My go-to veneer of choice is still an Emax veneer. I'm not doing nearly as many Empress veneers, hardly any, because the Emax veneers are 3 times as strong. So you can see we've pulled the BruxZir veneer out of the wood, it's still intact. There's been no chipping on the veneer itself. So we do in fact now have a very high strength veneer material that can be used. It is of course not as aesthetic as Emax. So in a patient with normal wear, a patient who hasn't broken any previous restorations, my choice is still going to be the Emax veneers. But if I see a patient who's broken Emax veneers or broken PFMs in the posterior or shows a lot of wear on their anterior teeth, I'm going to seriously consider the BruxZir veneers, because even though they don't look as good as the Emax, they're 3 times as strong as the Emax veneers. That about wraps it up for episode 12 of Chairside Live. On behalf of myself, Megan, and everybody here at the laboratory, I'd like to thank you for your time and your continued commitment to quality dentistry.
We'll see you next time. It looks like the folks over at ABC's popular morning talk show, The View, are biting their tongues after recent comments regarding dental hygienists. And it's... Dang it!
Dang it. Put your happy place.
Yeah, I know, right?
Can you cut to me biting my tongue when she says that?
Oh gosh, okay.
That about wraps it up for this week's edition of Chairside Live. Now it's over.
It's over, Johnny.